safe in adults and kids, and it's very sedating. And so, for folks who have mental health concerns, oftentimes depression, anxiety, and other disorders, sleep is very often a problem, and the Desaril or Trazadone is a very good option. It doesn't produce any physical or physiological dependence, and it's got a good safety profile, and so it also can serve as a little bit of a boost in combination with other treatments for depression, because it does affect serotonin, which we know is critical for treatment of depression and anxiety. And so, whereas the trazodone was initially intended as an antidepressant, it's got indications for depression, it's got indications for withdrawal from substances, cocaine, and other drugs. And then there are multiple other uses where it's beneficial. But in my practice in mental health and most of the work that I see now, trazodone is used primarily as a sedative, a safe sedative to help with sleep.
Okay, can you talk about misuse a little bit?
The trazodone, as well as a number of other drugs, can be abused, meaning there's misuse of it for an unintended purpose. That's to be distinguished from someone who's dependent on a medication or a drug. Physical or physiological dependence means that with prolonged exposure, there are changes in the brain and body that you will have withdrawal if you don't continue to take it, or if you stop it abruptly because of the changes associated with prolonged exposure to that medication. Trazodone does not have the physiological dependence, but it is psychoactive. It does cause sedation, and as such, it is abusable. Meaning people can misuse it for purposes of getting intoxicated, combining with other medications or drugs, or other unintended non-medical uses.
Do you find any newer drugs to be more effective than trazodone that you're working with presently?
Well, when it comes to sleep, trazodone is a favorite. Again, because it works, it's not addictive, and it is largely safe. As far as antidepressants, then absolutely. I think the fact that the use of trazodone is primarily for sleep, or much more commonly for sleep, says a lot to the fact that other antidepressants are oftentimes more effective. And then the other piece is that sometimes sleep is not a problem, or insomnia is not a problem, and so folks with depression or anxiety who don't have sleep problems, you wouldn't necessarily want to give them something that would be so sedating.
Okay.
We're in essence taking advantage of a side effect of a medication.
All right. Well, thank you so much.
You're welcome. Hope it was helpful.
Thank you.